everyone. My name is Lindsay Lemmer. I'm the current alder for District 3, and I'm running for re-election. I'm joined by Ryan Jennissen, who has served as a mental health officer with the Madison Police Department, and he's a resident of District 3. We're going to be talking about mental health calls and the establishment of a pilot mobile crisis unit. Establishing a mobile crisis unit is something that I'm proud to have supported and sponsored. I'm excited that we were able to have a pilot in this year's budget that will include 24/7 service. And Ryan and I are going to be talking about the importance of this and why it's a good thing. So Ryan, thank you so much for being here.
Yeah, glad to help out. Thanks for having me.
Absolutely, thank you. Can you talk about your experience with mental health calls? How many as a percentage of calls for service are there about in Madison, and why this is an important program to have based on your experience?
Sure. Yeah, just again to tell you a little bit about my background. I started with the Madison Police Department in 2013, and I worked as a Madison Police Officer until just recently. I just resigned in January of 2021. I was a mental health officer from beginning of 2017 until I resigned a month ago. Obviously, I don't have the most updated figures, but in being in that mental health unit for the police department for the last 4 years. A good rule of thumb for the police department is on any given day, there's between about 300 to 500 calls for service. That's total. That's everything from, like we're experiencing a lot of car thefts, break-ins, burglaries, mental health calls, between 300 and 500, a little bit less in the winter, a little bit more in the summer. Approximately 10 to 15% of those calls are mental health related. So at any given day, if you take a look at that, 10 to 15% is, around 40 to 50 calls for service that are mental health related. Another way to think of that is there's 2 every hour. That can be anywhere from something extremely, maybe a little bit not as urgent, maybe someone just saying, hey, I need a ride to the hospital, to possibly a full-blown crisis that requires emergency response, ambulance, possibly police. My job as a mental health officer, in those 4 years I served as a mental health officer, my job was to assist frontline patrol officers in supporting them when they were especially in contact with people in crisis. What I would do is I would help support them by putting them in contact with our crisis unit, our law enforcement crisis workers that work in conjunction with the police department. In addition, I would provide also an important follow-up. For instance, if someone was calling and needed assistance, but it didn't require police possibly taking them into protective custody to keep them safe, maybe it was a lower level than that, is I would help do follow-up. Okay, this is somebody that we're concerned with that could reach a full-blown crisis. What type of community supports are they getting or not getting that maybe we can put them in contact with to avoid a full-blown crisis? Unfortunately, because of the way our healthcare system is with high costs, low insurance, there's a lot of individuals that are experiencing mental health issues, but don't have the resources to do that preventative care that maybe others in our community do. So the first time that a community partner or community service recognizes that is, unfortunately, many times is a call to 911, which involves police. So as a mental health officer, my job was to try to bridge that gap the best that we could in contacting people and putting them in, give them the ability to hopefully get additional community resources and to hopefully prevent them reaching that full-blown crisis.
Gotcha. Thank you. And can you talk a little bit about why having a mobile crisis unit with a community paramedic and a crisis worker, why that is going to be helpful?
Yeah, like I said, and on any given day, police are responding to dozens and dozens of mental health calls. on any given day, a police officer will have to
Mhm.
do a traffic stop. They might have to respond to a crash, an accident, respond to somebody that's having a drug overdose, a domestic, a robbery. They're asked to be experts in so many things.
Mhm.
And because of that, if we can find ways to divert some of those calls to individuals that specialize in, for instance, mental health, I think that's one way to help reduce the amount of pressure that's put on police to be that jack of all trades.
Mhm.
I think if we can have that specialization, like this mobile crisis unit, where we have individuals that are getting these calls that are that intermediate area where it doesn't reach the level of a full blown crisis where an immediate police response isn't necessarily needed, we can hopefully and possibly divert a lot of those police resources into this community response and get them in contact with the help that they need. Mental health, unfortunately, still has a lot of stigma attached to it. And the way that we have traditionally responded to mental health calls doesn't help that stigma either. I've always thought that when I was a mental health officer, I wasn't a psychiatrist, I wasn't a doctor, I wasn't a social worker. I'm like so many of our other police officers out there. I just cared about helping people. But I'm showing up in a squad car. I'm showing up in a uniform with a badge and a gun. And now I'm put in a position where, although I have fantastic training and I have a lot of great support, maybe me responding to somebody that's having a mental health issue might not be the best use of my time and may not be the most helpful for that person. So if there's options that we can look to, like a paramedic with a social worker that can come and start talking to these people, they can assess the situation, and then based on their training experience, then they can help divert resources to take that individual to a hospital, maybe put them in contact with other resources, or maybe this is a situation that does require police too. But I think having that additional option is going to provide, number one, better service for our people that are having mental health issues, and number two, divert police resources in more effective ways than they currently are. I think, especially starting a pilot program to work out those bugs and to hear from our community members on how best to work through this is a step in the right direction when it comes to getting our um, getting our residents in a better place to receive services, but also getting our police in places that they can do the most good too.
Yeah, absolutely. And establishing this mobile crisis unit, while it's great that we have a pilot this year, I know it's taken a lot of work, not just at the city council level, but I know the community has been involved for a while to get this going as well. Do you want to share some information on your efforts to help get this going?
Um, when I was a mental health officer for this city, one of the things that we are lucky enough to do is that we have a partnership with Journey Mental Health, where there are three embedded law enforcement crisis workers who are they serve like 2 days a week as crisis workers on the crisis unit and 3 days a week embedded with the Madison Police Department. And so that work laid a lot of the groundwork for establishing the framework on what that relationship between crisis workers and a paramedic can be. I also consulted with my supervisor as she was working with the city to help establish, for instance, I guess, develop the call trees on how calls are going to be diverted moving forward with this.
Wonderful. And what do you see as important in making sure that this is successful? And what do you think are the best next steps for the pilot mobile crisis unit?
I think what you need to have is a cohesive collaboration between the 911 center. They're obviously the node that's going to be taking many of these calls from individuals that are having mental health concerns, mental health crises. It's going to start with the 911 center. And then it's also going to be collaborating between the fire department with the paramedic and then also police, because between those three units, in amongst all of those is this new mobile crisis unit. They have to work with all three of these units in conjunction. I would like to say that yes, we can remove police completely, but unfortunately that's not the case that we have right now because of the way that our laws are written currently in Wisconsin. Chapter 5115, if you want to do some really boring reading, that requires a police presence for those that need to be taken into protective custody. So I think establishing that strong relationship and collaboration between 911 center, the fire department, and the police department, so that there's a real good understanding of these are the types of calls that this mobile response unit will be responding to. This is when we're going to get the fire department involved. For instance, maybe this call comes in and it seems at first the 911 center triages it and it seems like the perfect call for the mobile crisis unit to come in. Well, they get there and they said, you know what, we need an ambulance there. They have to call for an ambulance and paramedics, or maybe they say, you know what, we need police there. On the other hand, there has to be that trust the other way too. If police go to a call that they get dispatched to from 911, and after taking a look and triaging, say, you know what, this call is better handled by the mobile response team, mobile response unit, then having that relationship where then they can be called in to take that call from there. And so I think it's going to take that strong relationship between those three units to really make this work. And so that second step is building that trust and having good leaders in Madison that want to establish this program, that understand that want to work for that long-term goal of taking this pilot, but then also seeing how can we turn this into a true progressive model that we can change the way that we respond to mental illness and change the way that we respond with our policing.
Yeah, absolutely. Ryan, thank you so much. I really appreciate your time and your insights and expertise, and really appreciate everything that you've given to our city and our community. Thank you.
I appreciate that. Thank you.
Thank you everybody for watching. There will be several upcoming videos on important topics facing our city as well. Thank you.